Your doctor said you needed the care, but Medicare stamped it not medically necessary, and now you're wondering if you're stuck with the bill. Before you panic, this denial often means Medicare did not get the proof they wanted. Most of these denials come down to just a few common issues. In the next couple minutes, I will show you what Medicare looks for and what can be done to fix it. These denials usually happen for three reasons: no approval on file, not enough documentation, or the diagnosis did not match Medicare's coverage guidelines. And this is important to understand. It can feel personal when you read not medically necessary, but this is not a judgment about your health. It is Medicare checking whether the paperwork proved the rule was met. And that leads to the part most people do not realize. A denial like this can be reviewed. Your provider can send medical records and a letter explaining why the service was needed. Sometimes when Medicare receives clear documentation and explanation, some decisions change. That is why this step is important. Look at your Medicare summary notice or your plan's explanation of benefits. Find the denial reason and the appeal instructions. There is always a deadline. Once you understand the reason, the next step involves your provider. Ask your provider for your records and a letter explaining why the service was needed. Keep copies of everything you receive and everything you send. And this part is important before you pull out your wallet. Even after all that, a denial like this can still feel final. But many times it starts the process, not the end. Before you pay, review the reason and your appeal rights. If this still feels confusing, you're not alone. If you are confused about a Medicare denial and not sure what your next step is, you can book a Medicare coverage clarity session, and I can help you understand what your notice means and what your next steps could be.